Have you ever wondered how your body breathes without you even thinking about it? In this video, we're going to look into the anatomy of one of the most important features of the human body, breathing. We will start from the deep components of the respiratory system and then move through the superficial musculoskeletal and neural regions. We hope to show you just how much effort our bodies put into producing every breath. The lungs are the primary organ of the respiratory system and allow for the continual exchange of gases between the atmosphere and the blood of the human body. The lungs are encased by the thoracic wall located between the clavicle and the diaphragm and are separated medially by the mediastinum. The right lung consists of 3 lobes, while the left lung has 2, which are divided by fissures. Structurally, the left lung is smaller due to the placement of the heart. Lining the external surface of each lung is the visceral pleura. The internal surfaces of the thoracic wall, diaphragm and the mediastinum are lined with parietal pleura. The pleural cavity lies in between these and is filled with an oily fluid. As air enters the lungs, visceral and parietal pleura come into contact, decreasing the pleural cavity. Fluid within the pleural cavity decreases friction and increases tension during lung expansion. Within the internal layers of the lungs lies the bronchial tree, which extends from the trachea to the alveoli. The trunk of the bronchial tree, which is the trachea, divides to form the left and right main bronchi, entering the lungs through the hilum. Within the lungs, the main bronchi divide to form the lobar bronchi, which branch into the segmental bronchi and later the smaller bronchi. From the small bronchi, the bronchial tree divides into the bronchioles and further into the alveoli. With each division, the relative amount of cartilage around the bronchi decreases and the amount of smooth muscle increases, allowing bronchoconstriction and dilation. Notably, there is no smooth muscle lining the alveoli sacs, as the airways must be thin enough for gas exchange to occur. Protecting the lungs are the 12 ribs, which span the thoracic cavity. They articulate with the vertebral column posteriorly and with the costal cartilage anteriorly, called a costochondral joint. This, in turn, articulates with the sternum. Ribs 1 to 7, the true ribs, have limited movement as each rib articulates to a single costal cartilage. Ribs 8 to 10, the false ribs, have more mobility as they converge to one costal cartilage. And finally, ribs 11 to 12, the floating ribs, have the greatest mobility as they do not articulate to the sternum. The joints are synovial plane joints, which move the rib cage during respiration. Movement of the rib cage is caused by muscles in the thoracic region. Many muscles are involved in respiration, however, the most important muscle is the diaphragm, a large dome-shaped skeletal muscle that separates the thoracic and abdominal cavities. Contraction of the diaphragm moves it down, increasing the thoracic volume and allows for inspiration at rest. The external intercostals also aid in this. Normal exhalation does not require effort and is caused by diaphragm relaxation. In cases of forced breathing, other muscles are required. The muscles involved in forced inhalation are the serratus posterior superior and the 3 pairs of scalene muscles, which are located superiorly. The muscles involved in forced expiration are the internal intercostals, serratus posterior inferior and transverse thoracis. They decrease the thoracic cavity volume, which are located inferiorly. In some cases, abdominal muscles can aid in forced expiration. These decrease abdominal cavity volume and further decrease thoracic volume. As a requirement for all tissues, the muscles in respiration need blood supply to carry out their tasks. Most of the arteries branch off the subclavian artery to supply the thoracic wall. Others branch off the descending thoracic aorta, where the bronchial arteries are of particular importance, supplying the bronchioles. Drainage of the thoracic area is a somewhat complicated system, however, all veins drain into the superior vena cava. Muscular and autonomic responses are regulated by the respiratory centers, which are located in the brainstem. Information passes to these centers from a range of receptors, central chemoreceptors in the brainstem, as well as peripheral chemoreceptors in the aortic and carotid bodies. They give information about carbon dioxide levels, pH, and in some cases, oxygen levels. Other important receptors include stretch and irritant receptors in the lungs, receptors in the muscles and joints, and emotional signals from the hypothalamus. In response to this information, both somatic and autonomic motor nerves are innervated. The phrenic nerve innervates the diaphragm, and the intercostal nerves innervate the intercostal muscles. Accessory muscles are innervated directly by the cerebral cortex. The bronchial tree and lungs are also under autonomic motor control. The sympathetic control is through the cardiac nerves, which innervate both the heart and lungs. Sympathetic innervation causes the dilation of bronchioles. Parasympathetic innervation through the vagus nerve causes bronchoconstriction. So now that we've got an understanding of the components of breathing, let's look how these work together to allow airflow into the lungs. We first need to understand two principles. Pressure will decrease when volume increases, and air will move from a higher pressure area to a lower pressure area. As previously mentioned, contracting the diaphragm and external intercostals causes an increase in volume of the thoracic cavity. The ribs therefore move superiorly, like the handles of a bucket moving upward. Since the pressure of air inside the lungs is less than atmospheric pressure, air will passively flow into the lungs. This is inhalation. Relaxation of the diaphragm and external intercostals causes the lungs and capacity volume to decrease, increasing pressure and making air flow out of the lungs into the atmosphere where air pressure is less. This is exhalation. Contraction of muscles located superiorly allow the volume to increase even more than with quiet breathing. Conversely, the muscles located inferiorly allow the volume to decrease more so than quiet breathing. This may happen when exercising, coughing, or during asthma attacks. In summary, the bronchial tree is encased by the thoracic cavity. The ribs and muscles provide protection and movement of this cavity, which is both sympathetically and parasympathetically controlled, notably by important chemoreceptors which communicate in this pathway. The movement of the cavity and lungs, produced by the muscles and bones, causes the change in air pressure, allowing passive flow of air in and out of the lungs.